Hi, I'm Cheryl Stamm. I'm the orthopedic outpatient nurse navigator. My role today is to get you to surgery with as few questions as possible. I usually go over a timeline of events before surgery, a little bit about your hospital stay, and a little bit about discharge. So the first appointment that you'll have will be pre-admission testing. When you go for that appointment, take all of your medications, including over-the-counter items that you may take, in the bottles. The nurses there are going to go over those with you. They're going to let you know what to stop taking, when to stop taking it, most importantly, what to take on the day of surgery and what not to take on the day of surgery. You'll receive in the mail an event tracker. This event tracker has all of the important dates on it, but on the back side, it has a timeline of events that's going to help you through this process, starting at 2 weeks before surgery and working down the page to the actual day of surgery. So look for this in the mail. It's very helpful. When you're at pre-admission testing, you have blood work, an EKG, and a nasal swab. Now the nasal swab is checking for MRSA. It lets your physician know which antibiotic to use in the OR. They're going to talk with you about 3 other things. So make sure you listen, but it's also on the event tracker. Bactroban ointment. It is a prescription that you'll pick up from the pharmacy. You can pick that up anytime, but you don't use it until the last 5 days before surgery. The easiest, less messy way to do that is place a small amount of ointment on the Q-tip, swab just inside the right side of your nose, flip it over, and do the same thing on the other side. That helps kill bacteria. Hibiclens is a soap available at the pharmacy, but not a prescription. Pick that up anytime, but you don't shower with that until the last 3 days right before surgery. They'll let you know the directions for that, but it's going to kill bacteria on the skin. And then they're just going to make sure that you've got the date, time, and phone number so you can call to check on your arrival time. I know when you scheduled your surgery that they mentioned you're going to need an appointment with your family physician. It's good to make that appointment a few days after your pre-admission testing appointment. When you have your blood work, your EKG, your family physician needs to see those results. That's why we have you make that appointment after they've occurred. When they see those, review those, they're going to let your surgeon know that it's okay for you to have your surgery. Now we're up to the day of surgery. They're always going to have you get to the hospital a couple of hours early. They do manage to keep you busy though, so you're going to have paperwork to finish, IVs to get started. Then you're going to go to the holding area. In the holding area, they make sure they have the right patient for the right doctor for the right procedure. He will come there and autograph your hip so that you know this is the surgery I'm having. It's a big patient safety thing. Everyone's on the same page. Now the surgery itself takes about an hour and a half to 2 hours. Then you go to the recovery area. The nurses there make sure breathing, blood pressure, and pain okay before they're going to send you up to the unit. You'll be on the total joint unit, 24 nice big private rooms, therapy gym right there on the same unit. Great teamwork between therapy and the nursing team to make sure you're getting up and moving, and you're going to be out of there hopefully within the next day. About a couple of hours after you got to the unit, the nurses have checked your IV, they've checked your vital signs, they've made sure everything's moving okay. The therapy team's going to come to your room. They're going to have you stand at the bedside, take a short walk, and then sit up in the chair for a little bit. Early mobility helps with stiffness, it helps with pain, and truly mobility is a huge part of the success of your surgery. The nurses are going to be in and out of your room an awful lot that night. They're going to check vital signs. They're going to check the IV. They're going to ask about your pain. They're going to use that 0 to 10 pain scale. How's your pain? It lets them know what pain medication to use, and then it also lets them know if it was successful. Did we have good pain relief with that medication? Now, drawbacks to pain control. Sometimes we worry that the nurses are awful busy and we don't want to bother them, or we don't want to be a pest. Sometimes, especially after hip surgery, you may say, wow, this isn't as bad as I thought it was going to be. I'm going to wait and see how this goes. And I don't want you to do any of those. If you feel pain, let your nurse know. Get something in your system so pain does not get ahead of you. It's very important. Now, typical length of stay after hip surgery is 1 day. So the next morning, between 5 and 7 in the morning, they're going to come get you up. You do get to wear street clothes, so as you plan what to bring, think nice and loose and stretchy, especially up in the waist and the hip of whatever you're wearing. You can wear shorts, that's fine, athletic pants, capris, whatever you want to do, just nice and loose through the waist and in that hip. After you get dressed, you have breakfast. First therapy is going to be about 9 or 9:30. They're always going to give you something for pain before you go to therapy. That way it's in your system. You're going to be able to move when you get there. First thing in therapy, you're going to do exercises. Now the exercises are in your book, so look those over. You're going to do them before you come to the hospital. It makes it easier to do them when you're there. But you're going to continue doing those exercises when you get home. So important to look those over. In the therapy gym, they also have steps and a ramp, a pretend car, a bed, the bathroom, the shower, so you can practice doing the things you need to do when you get home. You're going to be successful. We're going to help you get there. Now, after that morning therapy, there is a discharge class. So really important to have a family member come to the morning therapy, see how the exercises go, and come to the discharge class. A lot of good information. Sometimes when you have pain medication in your system, you get a little drowsy, so it's nice to have someone else there to hear it so you can compare your information later. Then you go back to your room for lunch, one more therapy in the afternoon, and then home about 4 or 4:30 in the afternoon. So it's a very quick time in and out of the hospital. Now when you get home, you're going to need a walker. Now the walker, we like you to have wheels on the front, no wheels on the back. Borrow one if you can. If you've got one, that's great. If not, we'll help you get one when you're in the hospital. You're not going to use it for a long time. It's going to be a short transition for you. You get to decide when you want to switch to a cane. So we use the framework of the walker. When you feel like you're walking safely, steadily, and without a limp, then you decide that you want to switch to using the cane. The cane is a single point cane, so nothing special about that. You're going to go home on a blood thinner. Now the blood thinner that we're using is Eliquis. You're going to take that twice a day for a month after surgery. All patients who have hip surgery are at risk for blood clots. We prevent that in the simplest way possible, and the Eliquis has done that very well for us. Now you're going to wear compression stockings. You can wear those for 4 to 6 weeks after surgery. They compress the lower leg, so that helps prevent blood clots also. The dressing that we're going to use is an Aquacel. So the Aquacel seals around the incision like a big old Band-Aid, sticks around all 4 edges and protects that incision. As long as everything remains intact, it's doing its job. There are no dressing changes. You can shower, just pat it dry. Now, the dressing's in a little bit of an awkward place up here on the hip, so every time you pull your pants down, you may notice it hangs a little bit. So it may have a little bit of a roll at the top. That's okay, but because majority of it's going to be stuck down. If it's just a roll, that's okay. If it comes off, that's obviously a different story. The incision's going to be protected by this part right here. So out here in this middle location, all incisions have drainage. So you may notice some dark circles, some dark lines. We call it shadowing. And that's okay as long as the edges remain intact. We know there's going to be swelling in your hip. We know there's going to be swelling in your thigh and oftentimes down towards your knee, so the upper and lower thigh. This is all a normal part of the process. We know that as you begin to heal, you may have redness and warmth in that area. So as we look at things and we say, oh my goodness, there's warmth, there's redness, there's swelling, what's wrong? Nothing's wrong. Those are all very, very common. When you come back to see us, we still expect there to be swelling, redness, and warmth in that area. If it becomes an angry red or a hot to touch, we want you to call our office. That's important for us to know. Now, when you get home, you have change in activity, you've had surgery, you're not drinking as many fluids because things don't taste good right away. and then you add pain medication on that, you can have some trouble with constipation. So you want to plan ahead and have a stool softener or Miralax or the equivalent of that, just to stay on top of that. You're very miserable if you're constipated. Some people just getting home do fine. Other people need to keep an eye on that. So I will be calling you within the next few days to talk about things personal to you. Go over your medications, talk about your discharge plans, see if you have any resulting questions after you've watched this video. So thank you for joining me today, and I'll talk to you in a few days. Thank you.